afternoon, everyone. I'm Gu Tang from Xiang-Ya School of Nursing of Central South University. It's my thank you for your invitation. It's my great honor to share my research work on WHO Collaborating Center webinar. And today's topic is palliative care in community, the opportunity and the challenges in China. First of all, I would like to a bit introduction of my city and my university. And I'm in Changsha. It's the capital city of Hunan province, and it's a very famous historical and cultural city. And Hunan has a Xiang-Ya, is a national forest park, and also the ancient town and few lakes, the Fenghuang, and also this is the Orange Island and the Yellow Academy. And the Yellow Academy is one of the most ancient academy in China. And I'm from Central South University. This university is a national key university administered by the Ministry of Education of China. And Xiang-Ya School of Nursing was founded in 1911, coming from the Yale China Care School. In the fourth China discipline ranking, the lesson of Central South University ranking A+. So first of all, I would like to share some key facts of palliative care. And palliative care improves the quality of life of patients and that of the family who were facing the challenge associated with life-threatening illness, and whether physical, psychological, social, and spiritual. Each year, an estimate 56.8 million people, including 25.7 million in the last year of life, are in need of palliative care. And worldwide, only about 14% of the people who need palliative care currently receive it. And the global need for palliative care will continue to grow as a result of the aging of the population and rising burden of non-communicable diseases and some communicable diseases. And palliative care involves a range of services delivered by a range of professionals that all have equally important role to play, including the physicians, nurses, support workers, paramedics, and pharmacists, and physiotherapists, and volunteers in support of the patient and the family. And early delivery of the palliative care reduce unnecessary hospital admission and the use of health service. And palliative care in China. As we know, China has a huge population, and hospice and palliative care was introduced to China maybe 20 years ago. During these 2 decades, most of the practice on palliative care follow the steps of the developed countries. So there are some milestone development of palliative care in China. In February 2017, the State Health Planning Commission issued a guideline for palliative care, and the first batch of palliative care pilots were launched in Beijing, Shanghai, Jilin, Henan, and Sichuan with reference to WHO's standards. In May 2019, a second batch of 71 pilots were launched nationally. And with the Chinese government has clearly proposed implementing national strategies to actively respond to the population aging, and has deployed the actively response to the population aging as a national strategy. We are thinking about the localization policy and guideline of palliative care after several years pilot work on palliative care. So Innovation Forum on Localization Policy of Palliative Care in China was just recently held in Beijing on June 12, 2023. And this is a very meaningful and constructive forum on palliative care. A variety of key stakeholders from the government, the researchers, and the practitioners from the university and the hospitals were invited. And the president of the Renmin University of China, Mr. Du Peng, hosted this forum. And Xiang-Ya from Elderly Health Division, Chinese Health Commission, and Wang Xiaoe from Beijing Municipal Health Commission. This tool is from the government. They illustrate the government's position that in the context of implementing national strategy to actively respond to population aging, the Chinese government will accelerate the development of palliative care practice. The forum also invites some representative scholars and practitioners on palliative care in China. Professor Lu Guijun from Changgen Hospital of Tsinghua University. And he has done a lot of work on pain management for the end-stage patients. And Professor Zhou Xuan is a pediatrician at Beijing Children's Hospital. And she is a pioneer in the areas of pediatric palliative care. And she is the founder of the Home of Daisy. The Home of Daisy is the first palliative care institute for children in China. And Wu Yumiao is from Shanghai Palliative Care Management Center. Actually, Shanghai did a very good job in the areas of palliative care. Up to now, there are 74 medical institutions that provide palliative care, and Shanghai has served 1,687 cases of end-of-life patients. And the practice in Shanghai provides a good model for some other developed regions of China. And Professor Jin Jun is a very famous sociologist from Tsinghua University in the areas of medical sociology. And she published a lot of representative articles on the values of death and the dignity of life. Actually, the opportunities and the challenges of palliative care in China. Although the palliative care is included in the law of People's Republic of China's healthcare and health promotion, and the financial cost and the absence of national standards and the systematic development strategies are major problems. And although 2,000 palliative care health carers were trained between 2021 to 2022, and 5,000 will be trained by the year of 2030. The shortage of professional palliative care staff is severe. And facing difficulties from slowing adoption of palliative care and the rapid aging population. We have to note that most Chinese people believe that only dying patients need palliative care. And the current pilot work of palliative care is focused on the tertiary hospital system, which reflects the government's concern and commitment to the quality of life of citizens, as well as the unique starting points of palliative care in China. You know, most of the palliative work happens in the tertiary hospital, but the tertiary hospital in mainland China is very, very busy. And my husband is a dermatologist, and for one day outpatient work, maybe she have to see maybe 80 patients for one single day. So given the huge aging population in China, primary health care system and community should be the main setting of the palliative care practice in the future. So how to enhance the capability of palliative care practice in primary health system and community is a big issue. So I would like to share with you our work in palliative care. And actually, this work is this study is inspired by the factor that providing palliative care to elderly with chronic disease at the early stage of the disease is expected to benefit the quality of life. Therefore, we need some screening tool to identify the elderly with palliative care needs. So we do a very little study about the translation, adaptation, and psychometric evaluation of the palliative care screening tool among the elderly with chronic disease in China. So the background of this study, the irreversible decline in physiological function brought by aging and the symptom pattern brought by chronic disease amplifies the demand for palliative care services in elders with chronic diseases. And the community as residents living and gathering place and the screening of elderly in community would reach a large target population who have unmet palliative care needs. But currently, the commonly used palliative care needs screening tools for community dwelling elders with chronic diseases are divided into two categories. The first category is a specific screening tools that is suitable for a particular chronic disease. For example, the Chinese prognostic scale. And the second category is the universal screening tool that is suitable for the diverse chronic disease. For example, the PCST used in our study. So in China, the diverse chronic disease screening tool used within community are specific to cancer patients and do not accurately assess the palliative care needs of the elderly with other chronic diseases. So compared with the existing screening tools, the PCST is developed to identify unmet palliative care needs of elderly with chronic diseases in community setting and is suitable for patients who are likely earlier in the illness trajectory. So previous studies have demonstrated the PCST is feasible to implement and accepted to the elderly. So therefore, this study aims to translate the English version of the PCST into Chinese and make cross-cultural adaptation and investigate the psychometric properties of the Chinese version of PTSD among the elderly with chronic disease in mainland China. And our study consists of two phases. First phase is the translation and adaptation of PCST. This phase follows the steps of Beaten guideline, including the initial translation, synthesis of the translations, the back translation expert committee, and the test of the pre-final PCST Chinese version. And the second phase is the evaluation of the psychometric test. We did a cross-sectional study to test the validity and the reliability of the PCST Chinese version. And for the psychometric properties of the PCST Chinese version, we use the reliability and validity analysis. This kind of constructions we used in our study. So the result, actually, the original version of PCTS includes the subscale, 3 subscales with 22 items. After the translation and cross-culturally adaptation, we modified some parts of the scale. Firstly, we the physical symptom subscale, the item, loss of appetite or gradually weight loss were added. Actually, it's influenced by the Chinese traditional culture. The diet plays a very important role in Chinese people's daily. Appetite largely reflects the people's physical state. So in addition, the integrated palliative care outcome scale also uses this indicator to assess the palliative care needs. So secondly, and the item 9, feeling down, depressed, or hopeless. Actually, the meaning of down, depressed, and hopeless within the Chinese context are different. So according to the experts committee discussion, hopeless was considered as a deep down feeling about innermost worries and desperations. And whereas the down or depressed describes the low mood. So we divide the item 9 into 2 separate items. For the item 21 and item 22, because in China we do not have official and legal documents about healthcare proxy and living will. Therefore, we removed these 2 relevant items according to the practice application of palliative care in China. So this is for the participants' characteristics of the cross-sectional survey, the demographic and clinical characteristics. And we have 70% of the participants are female. So this is the result of the psychometric test of the PCST Chinese version, and this is the value of the each construct of the reliability and validity. So for the exploratory factor analysis, actually, they are in the subscale of physical symptom. There are some of the items were not loaded very well, which are analyzed as being related to the maybe we did some modification for this subscale, and also the different cultural values of palliative care among the Chinese elderly population, and is different from the Western ones. So the limitation and the implications. This study is just conducted in Changsha City. It would be inadequate to generalize the results to the whole country. The participants in our study have been in a stable condition, leading to a selection bias in a pool of relatively well-faring participants. And because of the limited sample size, we didn't do the confirmatory factor analysis. The socio judgment criteria of screening positive do not involve cut-off scores. So future studies can explore the valid and reliable cut-off scores and of PCST and PCST Chinese version in different contexts and populations may be necessary. And the PCST Chinese version is a simple, clear, and comprehensive and psychometrically robust scale. Health workers can use it to screen the unmet palliative care needs for the elderly with chronic disease in the community. And the conclusion, the PCST Chinese version is a reliable and valid measure for identifying palliative care needs of older adults with chronic disease in the community. And future studies with multiple sites and different types of samples are recommended to validate and further refine the PCST Chinese version for use in the practice.